Hey, and welcome to Module 3. This is the module that we focus on heart health. Heart disease is the number one killer of Americans and people worldwide. So, the goal of this module is to make sure you understand how to recognize and address this leading killer. So, here we're again going to make sure that your heart is never a limiting factor in your longevity. Just so you can see the whole slide, I'm going to turn myself off here. Again, we're going to help you live at your peak for your whole life. So, what affects your heart and what leads to heart disease and heart attacks is actually coronary artery disease. So, often doctors will focus on numbers like cholesterol, LDL, and hypertension, blood pressure, inflammation. The most important thing to pay attention to is the health of your artery wall. So our goal here is to actually manage what's going on in your artery walls, not to just look at the numbers. So again, the old way, looking at numbers. The new way is to actually visualize the plaque and address the disease. So if you're in my practice, you've likely heard me talk about coronary angiogram or coronary CTA with plaque analysis. And that's exactly what plaque analysis does, is it tells me what's going on in your blood vessels, which allows me to manage those numbers with more precision. And it's not only the plaque burden or how much plaque you have that's important, it's also the kind of plaque that you have. So importantly, when we're looking at plaque, there are three kinds that are identified in the coronary angiograms with plaque analysis. There's the stable calcified plaque. These can be obstructive, and it's not good to have a lot of calcified plaques, but they're generally stable, not high risk. The type that are high risk are these vulnerable soft plaques, which are non-calcified. These can be obstructing, as shown here, but they can also be non-obstructing. In other words, they can be hiding in the side of the wall without obstructing anything. So it's important to do a plaque analysis to identify if you have this type of high-risk plaque. In fact, in people who have, for example, a 0 calcium score, a lot of people have had CT calcium scores. Even if it is 0, about 30 to 35% of people with a 0 calcium score will have actually a soft plaque in the wall of the blood vessel. So the levers that we can pull, the main things that we look at to address plaque is lipids. We look at your LDL cholesterol, ApoB, which is a marker of cholesterol particles, and then blood pressure is also important. So as you can see, the optimal long-term ApoB is under 70, and the optimal long-term blood pressure is 115/75. Anything more than 115/75 shows a little bit of increased risk. So you can think of lipids as sort of a amount of time that you're exposed, or that your blood vessels are exposed to lipid particles. Just like with smoking, the more cigarettes that you smoke and for the longer that you smoke, the more risk there is. It's called pack years. Similar to that, the higher your ApoB, or the more particles you have, and the longer you have them, the higher the risk that you have. So our strategy is to make the ApoB, or make the particle count, sufficiently low such that we start to get some reverse cholesterol transport. In other words, we start to get some cholesterol out of the blood vessel wall instead of it being deposited in the blood vessel wall. So that is our big goal, is to minimize the exposure to ApoB particles. Blood pressure enhances the damage that ApoB does. This is just a number. The blood pressure, it actually is measuring the mechanical force inside your arteries. So as you can see here, the pressure is pushing on your arteries. And when blood pressure is high, it damages your endothelium, as seen here. You can have micro tears in your lining of your blood vessel. When you have this, your increased risk of having this cholesterol deposition, LDL particles deposited in your blood vessel wall, leading to coronary artery disease. So we do use medications. I do prescribe medications for people who are in my practice for cholesterol, but importantly, diet and lifestyle are super important for this as well. In fact, there's published studies showing that a very strict diet and lifestyle protocol does decrease plaque. Both Dean Ornish and Caldwell Esselstyn have published these. You can look them up. Here we are again with the Green Mediterranean diet. This is the diet plan that is associated with less disease, better health. And I'll let you read the rest of this here. And we'll talk more about this in the next slide. You can see here, though, that Green Mediterranean really means mostly fruits, vegetables, whole grains, legumes, protein with tofu or a little bit of animal products, if that's your preference. So importantly, if you have severe heart disease and you're trying to reverse it, you're going to need to be a lot more strict. The old adage, an ounce of prevention is worth a pound of cure, definitely applies here. If you eat a generally consistently healthy green Mediterranean diet, it can be relatively imperfect and still be very helpful. But once you've progressed into having significant heart disease, you need to be a lot more strict. Exercise is key for heart health. Again, we talk about 3 different types of exercise: zone 2 training or low intensity cardiovascular, vigorous training or higher intensity intervals, and then strength training to build your lean body mass. So stress. Stress enhances or increases the risk of every chronic disease. Chronic stress leads to, a constant acceleration of the fight or flight response, leading to increased heart rate, blood pressure, inflammation, higher blood sugar, poor sleep, and it's a vicious cycle. So learning to manage stress, was part of the Dean Ornish program that I showed a few slides ago, which can help reverse heart disease. So using things like breath work, meditation, yoga, these types of modalities have been shown to make a difference. So sleep, if you're stressed, not managing stress well, you're not going to sleep well. Sleep is very important for pretty much every health outcome. The number one thing is to ensure that you don't have a sleep disorder like sleep apnea. After that, we work on optimizing. So again, our goals here, we look to see what your risk is. Hopefully you've had this done. If you are at high risk, we control the risks with lipid and blood pressure management with both diet, lifestyle, and medications. And then we build on that to improve your health for life so that your heart stays healthy. And I'll let you read the last part of that. And I will post these slides as part of the education in Module 3 in case you missed some of them.